with all due respect.
Hey, we're Josh Ortegon and Greg Gaines, and this is With All Due Respect, the show where we keep it real about health, fitness, and performance. From weight loss to sports development, we're covering the conversations that matter.
Follow us on Instagram at Phenom Fitness, PHNM Fitness, and visit www.phenomfit.com to check out our training programs, coaching, and gear built for real results. Let's get into it. All right, y'all, back with another episode of With All Due Respect with Josh and Gray. Unfortunately, it's just Gray today. Josh is out sick, so it's just going to be me and Dr. Jessica London, who I have the pleasure of bringing on today. We are continuing our series on fertility and fertility health optimization when starting a family and into that postpartum life, right? So I'm bringing on Dr. Jessica London today, who is a doctor of physical therapy. She specializes in pelvic floor and in pre and postnatal care. So if you would, Jessica, Dr. London, what do you prefer?
You know what? Whatever works, to be honest with you.
Okay, perfect. If you would introduce yourself, tell us a little bit of background about you. I know that you said you have two kids, and your story really is based on a lot of what you went through with your pregnancy. If you'd introduce yourself, tell us where you're located, how you got into this, and maybe even just start to explain what pelvic floor physical therapy is, because I will be honest, 5 years ago, I had never heard of
hmm
pelvic floor physical
Yeah.
therapy. So take it away.
Yeah, absolutely. Well, thank you so much for doing this series too. It's so
Yeah.
incredibly important to get women, empowered education and advice even before or potentially during times that they're struggling. So this is such a blessing for so many women and mothers that you're bringing. So I just want to say thank you for that
Thank
first
you.
and for having me on. Yeah, like you said, I'm Dr. Jessica London. I live in the Phoenix, Arizona area. I am a doctor of physical therapy, specialized in pelvic health, but more specifically, really focusing and working with the pregnant postpartum population and return to strength training. We found that, through my own birth experience, I found back in 2019, that's actually how I got started into this work, was I was in orthopedic medicine. So I mostly focused on, post-surgical rehab, the weekend warrior, ankle sprains, knee injuries, shoulder surgeries, that type of thing, where that's where I really highly specialized before I had kids. And then in 2019 is when I got pregnant and ended up having my first child, very, very unplanned, unexpected C-section. Which I mean, if you're not pregnant or you're current pregnant, or you are a mom, it's just like one of these things that we think we're gonna plan our perfect birth experience, and it just never goes to quote unquote plan. And that's
Mhm.
exactly what happened to me as well. But that's actually what really opened my eyes. I was quite ignorant as well, like really didn't knew about the pelvic floor, got maybe a 3 hour lecture in my doctorate program about the pelvic floor and core, which is wild. And so even as a doctor of rehab, after having my first surgery ever, which ended up being a C-section to get my baby safely here, I still was like, what the heck? How am I going to recover from this surgery? There's no protocols, there's very little guidance and programs. And I actually was really ready to receive my level of rehab that I always gave to others in acute management in the hospital setting. And no one rounded the room. No one came to my bedside to teach me anything about getting in and out of the bed safely, how to care for my wound, and how to start rehabbing, which is very standard of care for typical surgeries in the hospital.
Right. So for anybody who maybe doesn't know, even what a pelvic floor is, I do
Yeah.
think this is something that's caught a lot of attention. So people might tend to think, oh, it's another buzzword, it's something else I should be training, something else I should be paying attention to. How would you describe that to someone listening?
Yeah, I would first say that everybody has a pelvic floor. Men, children,
Hmm.
babies, women, your parents, everyone has pelvic floors, right? And the pelvic floor is a group of muscles and connective tissue ligaments that sits at the bottom of the pelvis, right? So if you kind of think about finding your pubic bone and the front of your pelvis, and then all the way back to your tailbone and the back of your pelvis, and then if you kind of rock side to side while you're sitting, those are your sit bones. That is the span of that diamond shape that the pelvic floor is sitting in. It's almost like a hammock at the bottom of the pelvis. And so the pelvic floor has a lot of different functions, but you typically don't notice your pelvic floor unless you are having some sort of dysfunction. And that's when people start saying, wait a second, what's the pelvic floor? So it just so happens that, of course, during birth or pregnancy, we tend to see more women specifically start struggling with pelvic floor issues and learning about the pelvic floor for the very first time.
So when would ideally be the time that you want to start paying attention to your pelvic floor?
Yeah, I think it's just, if you don't even have a baby, you're in that preconception phase. I think everybody, every human, men and women, should get acquainted with this part of their body, right? We should all have the ability to connect to it, like energetically, spatially, like just if I asked you to close your eyes and find your right thumb, you would be able to kind of map that out visually in your head and find your right thumb somatically. But a lot of people are not connected to their pelvic floor in that way, right? So if we were to ask, everyday person, close your eyes and find your pelvic floor, they would be like, what? What is that? Where is that? Right? So I
Right.
would say that's probably the first place to start is just to start getting acquainted to where is this muscle located and how do I connect to it spatially? How does it contract? How does it relax? How does it lengthen? And what are its functions? So I think anyone can do that. But if you are in this pregnancy stage, typically around the second trimester, is when we more specifically want to focus on prenatal care around the pelvic floor and core complex, but also when we're thinking about birth prep so that we can get ahead and stay ahead of any pelvic floor or core related issues.
I know you've posted a good bit about how many people truly struggle with pelvic floor issues. Can you dive into what you commonly see, or maybe, what the stats may be for women that are dealing with these issues?
Yeah, so right now, 1 in 3 women, right? 1 in 3 women have some form of pelvic floor dysfunction, which is actually really high. And
Yeah.
this doesn't only mean pregnant postpartum. Actually, that percentage increases if you're pregnant and postpartum. So just at baseline, 1 in 3 women is dealing with some form of pelvic floor dysfunction. So people might be thinking like, well, do I have pelvic floor dysfunction? Like, what is that? So typically signs and symptoms of pelvic floor dysfunction is any loss of bowel or bladder, right? So if you're leaking, you have bladder leakage with coughing, sneezing, exercise, jumping. This is where a lot of our athletes will start popping up where they're like super fit, they've never had a baby, but they're like, every time I do double unders or every time I heavy squat, I leak a little, or I run for long periods of time and I notice leaking. This is still a sign of pelvic floor dysfunction. But those could be, one category of it. Other signs and symptoms could be pain with intimacy or pelvic pain, tailbone pain, really deep groin or hip pain can be really correlated to the pelvic floor as well. In addition to support, right? So the pelvic floor also, I like to explain it as the foundation of a house, right? So before you build a house, you're going to lay the foundation. That's the pelvic floor for the entire body's system. So if it's not functioning optimally, then you're building a house on an unsteady foundation. And so sometimes this can show up with lack of support for the pelvic organs that sit on top of the pelvic floor, like the bladder, the uterus, the rectum. These pelvic organs sit directly on top of the pelvic floor. And so sometimes these pelvic floor organs or these pelvic organs aren't supported well. We might start noticing like a heaviness or a dullness or an ache in the pelvic floor region, or the hips, the back, the knees are starting to kind of, show signs of dysfunction as well because you don't have good foundation at the pelvic floor.
hmm I saw you posted a clip maybe a couple weeks ago now, and something that we practice a lot in our coaching is it may be common, but it's not normal. And I think
Yes.
that's such a big beauty of social media is that we're now finding all of these symptoms that, have felt so normal in our lives, right? Or that we've just always dealt with for longer periods of time. And I think too, like even, women that are my mom's age, which is, close to their 60s, they're like, oh, when you pee a little, it's just normal, right? It's just
Hmm.
normal to feel that sensation because you've had babies. And what we're learning now through people like you is that it's not really normal. It might be
Mm-mm.
common because it was never taken care of, but it's really not normal.
Yeah, and I think it's been normalized because of the lack of support and education, right? I
Right.
think that's the only reason that we are at the alarming rates of statistics that we are. It is my belief system that if we equipped women, when they started getting their periods with this knowledge of their pelvic health and what does that look like and where's your pelvic floor and all of these things that we could get way ahead of it, but especially in this pregnancy postpartum phase when we start to see an increase in pelvic floor dysfunction, if we made sure that people had proper guidance, education, evidence-based research, and support, then we would see a drastic decrease in pelvic floor dysfunction almost immediately.
Right. It always blows my mind a little bit too, because this is obviously not a new issue. So I always question, why hasn't it been adjusted or taken care of or paid attention to until the last few years? Like, why are we just now hearing about these things, or why are we just now putting a heavier emphasis? Like, it took you going through, was it just your first birth or your second birth as well, until you really found a good plan for pelvic floor?
Yeah, so after my first birth is when I pivoted from
Okay.
orthopedics to pelvic health, but I did go on to have an HBAC, which is a home birth VBAC. And so I also dealt with some pelvic floor stuff with that postpartum as well. However, I was already a pelvic floor therapist at the time, so that just goes to show like having the tools, the resources, knowing exactly what to do, I was able to resolve it in less than 16 weeks. So it just was able to be there. I wasn't afraid of it. I started on my rehab protocol and I resolved it. It just was that simple. But that's what women don't have. They don't have access to the resources, the education, or even the awareness that it's not normal. But there again, like the actual rehab protocol and plan of what do I need to do to reverse this and make sure that this doesn't linger for the rest of my life.
Right, absolutely. A big thing that Josh and I do, we're fitness and nutrition coaches, so that's what a lot of our, day in and day out clientele or teachings, education, that's what it looks like. Can you touch on a little bit of how important strength training is as a whole or as a foundation for your pelvic floor health?
Yes, absolutely. It's a huge piece to the puzzle. I think that a lot of people get mixed with, oh, pelvic floor stuff is just Kegels and like basic
Right.
rehab exercises. And that's, unfortunately how some pelvic floor therapists, outdated pelvic floor therapists, are still practicing under that, philosophy or belief system that Kegels and bridges and like those are the only things that you're supposed to do to make your pelvic floor stronger. But actually, strength training, the whole system and the whole body strengthens the pelvic floor at the exact same time. So, anytime we're on a single leg stance or rotating on a single leg, we're absolutely activating that pelvic floor and strengthening the pelvic floor. We're contributing to lengthening and stability and endurance and coordination at the pelvic floor. So, what we find or our belief system and methodology is the hybrid between pelvic floor rehab and strength training. So, it's important to include those because early on where someone's really struggling with pretty severe dysfunction, they might need more basic lower level rehab level exercises. But as soon as we start getting past the basics, we need to get them back into everyday life and picking up their kids and picking up groceries and being able to work in their yard and get back into strength training and higher level activities so that they can continue to contribute to muscle growth and all of those things. And that transition into strength training is a part of good quality pelvic floor rehab.
Right. And that's why I always have such a big push of like, if you're thinking about having kids later on, or even if you're not thinking about having kids, but you just want to be a healthy individual at 70 or 80 years old, you got to start picking something up, right? Like you have to start strength training in some capacity. It's not just for, aesthetics or getting muscular or whatever, right? There's so many different things that strength training is connected to that's going to make XYZ so much easier or the recovery of that so much easier. So I love just like always hearing the connection of why strength training is so important in so many different aspects of our lives.
Hmm.
I
Hmm.
do a little bit unrelated, but I'm just curious with your births, why did you decide on a home birth the second time? I'm just very
Yes,
interested in that.
for sure. Totally. I'm an open book. So actually for my first birth, I also planned a home birth as
Okay.
well, but I ended up 3 days in labor. I was 42 plus three. So I was
Oh,
42 plus three days pregnant when I ended up going to the hospital and having a C-section.
hmm.
So I always have really believed in like the woman's body and, letting things unfold in the most conservative, natural way. That's why I got into physical therapy is because I believed that our bodies are truly incredible. They can heal themselves. They know what they're doing. We hold so much infinite wisdom in our body to heal. And so I just kind of took those same principles and belief systems to birth. What I didn't plan for is when you are preparing for birth, and this is what I didn't know what I didn't know, right? Before I became a pelvic floor therapist and really dove into more of a spiritual practice, I would say, and an energetic release practice is birth is, just as much physical as that is energetic and spiritual. And so, yes, we need to prepare our physical body, which is what I did for my first birth. I mean, I exercised and I strength trained all throughout my first pregnancy. I was like 41 weeks pregnant, still strength training. And I was doing all of the things that were quote unquote on paper that I should have done to prepare for this like perfect home birth, if you will. What I really didn't prepare was like my mindset and the release of control and, my former college athlete type A, like high achiever,
Yes.
mentality. These are the moms that actually typically struggle with letting go in birth. And I also struggled letting go in birth and letting it truly unfold. And so it really wasn't until my second birth experience, again, believing in home birth and really what it had to offer, but had to fight the odds of the healthcare system saying you should just have another C-section, but really standing firm and like, I believe my body can do this, but I prepared so differently for my HVAC than I did for my first home birth experience. And I think that's what actually led me to have a night and day, totally different birth and postpartum.
Was it a different mental preparation? Like, were you still strength training and doing all of those things that you would regularly do in your day-to-day routine, but the mental preparation was different work?
Exactly. Yeah. So I still did all the physical stuff that I knew I should be doing, strength training and my prenatal. I was still doing all the pelvic floor and birth prep stuff, but I focused a lot on my nervous system regulation. I focused a lot on my mindset and I focused a lot on like energetically releasing control. That
Mm.
understanding that, hey, I'm going to go through this birth experience, but this time I have no preconceived expectations that I will let birth unfold exactly how it needs to, and I trust the process, even if that means that I have to transfer to the hospital, even if that means I have to have another C-section. And so I do believe that that releasing of the control also allowed me to let my body fully relax and go through the birth process as I was laboring. And my first birth was like a 3-day type experience, ended in a C-section, pushed for 3 hours, still, all these things. It's just baby didn't want to come that direction. It was my greatest lesson. But my second birth at home, I was like start to finish 8 hours. And two of that was pushing. So it's like it unfolded and unraveled so quickly. But it was really, attribute a lot of it to the mental birth prep that I did.
I love that so much because I do, some of this can kind of get into that like woo-woo, right?
Hmm.
And people always want to coin it as woo-woo, but I
Yeah,
I kind of believe in the woo-woo. I think there
same.
is such a deeper connection that we have to our bodies and just like you were saying, like to nature, to being at your home for birth. I do think it's a very interesting subject. Do you think that there is a connection of that mental preparation to the health of your pelvic floor?
Yeah, absolutely. I mean, what's more and more I get deeper into pelvic health and working with clients, I notice patterns. And this is not something I typically talk about because it is can get a little woo, if you will. But if your audience is here for it, I'll go for it. Is,
Do it.
the pelvic floor and the throat are very similar in their anatomical appearance. And so the more that we work with clients and the more that I find, talking to women and mothers, we find this connection of the voice and the pelvic floor mirroring each other. And so, if there's unspoken desires, unspoken wishes, vocal tones, like people pleasing tendencies, like these things, we will also see the pelvic floor consistently hold tension or there'd be dysfunction in the pelvic floor or the womb space, right? So, all of this also is tapping into our deeper intuition and our wisdom as women and as mothers. But I say, hey, maybe you're dealing with pelvic floor dysfunction because it's the first time you're supposed to use your voice to advocate for healing for yourself. So this you go through this process and you end up healing your pelvic floor, and you also had to go through this evolution of advocating for yourself, speaking up for yourself, you're asking for, guidance and direction and help and whatever it meant. And it doesn't end up just being a pelvic floor transformation. It ends up being like an identity evolution for them as they get the support that they need. Of course, there's a physical component. I'm
Right.
very evidence-based as well. We have lack of coordination and strength and tone and all of those things in the pelvic floor. that will also present with pelvic floor dysfunction. But I do think that there is a very strong energetic component to pelvic floor issues as well.
It's so interesting. Well, you see too, that's been talked about in recent years is that women carry like a lot of trauma in their hips, right? And so
Hmm.
when you release that trauma, a lot of people will have this crazy experience. And I am somebody that firmly believes in that kind of release. And I think when you can kind of tie those things together and learn that you are really inside of your body, right? You are truly living inside of your body. Your it can become a lot clearer, or maybe
Hmm.
like your path can become a lot clearer.
Yeah, absolutely. And not to mention, like, the nervous system rules everything, right? So,
Hmm.
just like in fitness and nutrition, if our clients are so stressed out and they're not sleeping, like, their bodies are not going to transform. Their bodies are not going to be able to receive the healing that they need. And so, what we find too, especially with women and moms that we work with, they're stressed out and they're not sleeping. There's all
Mm.
these things that we have to combat to make sure that we're optimizing for healing for their bodies. So, I think it would be such a missed mark, or if you're seeing a pelvic floor therapist now and they're not including nervous system, stress management, energetic practices as part of your healing holistic plan, then there could be a missed element because we find too that once we get clients in a good space where they have, good, fresh, optimistic mindset and their stress is relieved and we're prioritizing sleep and hydration and nutrition, their muscles will respond better and they'll actually heal faster and they'll reverse leakage and heaviness and pain. All of that will subside faster if we also make sure that we're incorporating that entire system.
I love that you brought that up because that was one of my talking points that I had on here. And what I wrote down is how stress impacts recovery and physical readiness, maybe pelvic floor tension. What are some practices that you encourage your patients to go through, or the women that you see, to help them with the stress, or maybe the burnout that they might be experiencing, or just feeling like physically heavy?
Yeah. Yeah, burnout and that's chronic fight or flight state is
Hmm.
very common for moms to be in, especially, in the first year postpartum. There's a lot going on. And so I think one, just recognizing that, like understanding that, hey, you know what? Your body is going through a transformational time. We see you, you're doing a lot. And also, we can't just keep operating at that level thinking it's normal, right?
Hmm.
And so oftentimes the greatest work that we can do is pause and be with ourselves. And it sounds crazy again, but it's like literally how much of your day are you spending not on your cell phone scrolling, that you're not caring for little children or feeding your baby or making dinner for your family? Like, how much time are you actually just sitting with yourself to focus on your breath and your nervous system regulation and a quick meditation or going for a walk by yourself without any other distractions? Just listen to the birds, just listen and look around and see what's going on with the sunshine and the trees and like, can we get connected to nature? We totally miss this piece with moms, but it's just how we would support anyone that's in a chronic fight or flight state is helping them come back to themselves, helping them find those pockets. And it is harder when you have multiple kiddos running around or a baby that's screaming, crying because he's hungry. Like, it is harder, right? But it really is about pausing, slowing our breath, and knowing that from that breath, it will flow, and, continue to downregulate the nervous system.
That's awesome. And people forget too how much just our senses do for
Mm.
us, right? Like our senses start our digestion. Our senses, when we go outside and connect to nature, helps our sleep. Like there's so much just with the basic senses that you have in your life that could dictate how you're feeling and how you're managing your stress. That's incredible. I did want to jump to, you post a lot about the 6 week check-in and kind of like 6 week preparation and plans that you have for your patients and your women. Can you talk about the standard check-in for those women at their postpartum 6 weeks, and how you like to do things a little bit differently?
Yes, absolutely. This is like one of my favorite things to talk
I love
about because it's one of the biggest
it.
mismarks in the healthcare system. So yeah, in the traditional healthcare system and the current medical model, I would say we are so years behind in research. And we're also years behind in women's health research, right? That's also why we're just now starting to learn and talk more about women's health issues, is because for so long, women and in general were suppressed in research and we weren't well talked about in research. So in general, I think that this plays a part in the current medical model for pregnant and postpartum moms. But in the current healthcare system, if you are birthing in the hospital-based system, you're going to have a lot of checkups throughout pregnancy, probably like 12 to 14 checkups throughout pregnancy. But as soon as you have that baby, you are sent home and on your way. Best of luck, my friend. And you only come back for a 6 week checkup, which is typically 10 minutes. That's what it was for me. And after, fielding and asking thousands and thousands of moms, same exact thing. Some people said not even 10 minutes. Some people said they called and asked if I would do it virtually instead of in person. And so there is a massive gap between the time that you have your baby and 6 weeks. So, what happens for the first 6 weeks of the woman's body? No one's educating mother on how to care for herself. It's all about baby. And that's great. There's like their survival paradigm of what needs to have happen for a baby, of course. But there are little things that we can do that we call early acute rehab that take 5-10 minutes a day. It is not much and it can be done in your bed, but this is allowing you to start reconnecting to your breath, your diaphragm, your muscles, your pelvic floor and core system slowly and steady over time so that when you get back to that 6 week checkup, you don't feel like you've still been hit by a truck and then you're cleared for 10 minutes, cleared for exercise and intimacy, asked about birth control. Typically, moms are filling out a mental health form on a check, but there isn't a whole lot of conversation around, how mother is actually doing after that 6 week check. They're sent on and they're said they're cleared for everything and, just start exercise slowly. So really, truly, there is no guidance. There is no clear protocol right now as we're recording this podcast. They're in the current US based healthcare model where women are supposed to get checkpoints. There is a protocol based off of your birth injury or whatever it might be. Women are just sort of left to figure it out on their own, which contributes to this pelvic health epidemic that we're seeing.
Right, right. And I would argue too, if you're somebody that's, high performing when it comes to your sport or just your training in general, I would argue that that 6 week period is very trying
Hmm.
mentally, physically, emotionally, because you may feel out of body, right? You may feel
Hmm.
like you're not super connected to the body that you were in. And I think even just having that emotional, mental support of being like, okay, I know which direction to go in. I can feel like I have a plan ahead of me. I can feel like I can be connected to myself again.
Hmm.
So you mentioned the acute 5 to 10 minutes. That's where you kind of start. What does it look like for getting beyond that 6 weeks? I know it's probably very individual depending on the person, but what is it? What do you encourage when you start to get closer to that 6 week mark or to the end of that or beyond that 6 weeks?
Yeah, I like to always think about, the birth method itself, right? So a C-section is going to be very different protocol and recovery than someone who had a vaginal birth, right? So with a
Hmm.
vaginal birth, we're thinking that the pelvic floor, when mom is standing, the pelvic floor is already against gravity, right? It's already fighting against gravity when you're in a standing position. So from basic rehab principles, we do want to try to start reactivating and start connecting and coordinating in the least amount of gravity position first and then progress from there. So, kind of thinking about a vaginal birth, we're thinking about the first 6 weeks. You're likely starting, on your back or your side, and then you're moving to hands and knees, and then you're moving to some, half kneeling upright, and then you're standing upright, and then we're adding more resistance and bands and weights as your body tolerates it week by week by week, right? So typically the first like 0 to 12 weeks, I love to focus on more of a rehab type protocol. But some moms are ready earlier and some moms are ready later, right? There is no one size fits all approach, but some moms can start doing some weight training as early as 8 to 12 weeks postpartum, where they have been really diligent and consistent on week 0 and 1 and 2 and 3, that when they get to that 8 to 12 week mark, they're able to add in some upper body weight stuff or some dumbbells and some light resistance to their exercise and training. And then typically from 3 to 6 months, we really think about this as more return to high to impact. So we really love to keep moms, stationary if you can, strength
Hmm.
training, building up resistance slowly over time. But around that 3 to 6 month window is when we'll start doing more higher impact things like jumping or running or transitioning back to quicker movements. And that I would say that that's true for a vaginal birth. But on the controversy, if you have a C-section, we're treating this like surgery, right? Like
Hmm.
you're post-surgical. You had a major abdominal surgery, 7 layers were cut or sutured or separated to be able to get this baby earthside. And so we need to treat you in a way like a post-surgical candidate. And so those first couple weeks, those first 0 to 6 weeks is really focusing on reducing as many post-operative complications and how do we increase lymphatic and blood flow and how do we reduce swelling. And that can be by encouraging walking. There's some really good research on early ambulation for C-section moms to smoother recoveries, decrease bounce back to the hospitals with reducing infection, and just a general smoother recovery. But we're also thinking about wound management and wound care as well for that large incision. Again, for our second and third and fourth degree tears for vaginal birth, there's wound management as well, but not as extreme on the earlier side of things. So same thing with C-section, right? In a hands and knees position, now your gravity. So we
Hmm.
just think about, where is the highest injury? What was the birth method specifically? What injuries were present at birth, if any? And how do we progress you safely over time? We do that with our clients where we work one-on-one with. And honestly, if we could start with everyone in pregnancy, we would, but we can start as early as 2 weeks postpartum with our
Wow.
clients one-on-one. And a lot of women take us up on that because they're looking for support.
Yeah. Well, I think, once you get in, my cousin just gave birth. She's like my sister. So she gave birth
Mm.
2 weeks ago now, or almost 3 weeks ago now. But she's like, by month 9, I couldn't do anything. Like I was so large, with this baby that I'm like barely walking. And so she's like, I'm so ready to get moving again. So
Yeah.
I would totally agree. By week 2, I'm like, let's do this thing. I've got to do something, right? Like
Yeah.
I could not imagine. When it comes to maybe what women should be on the lookout for when they do start returning to any type of training, what could be some signs that there's dysfunction or maybe something that's just not right?
Yeah, definitely. So there's kind of like your clear medical red flags where if you are noticing an increase in like odors or something that's like burning or itching, these could be
Mhm.
signs of infection. Please go back and see your provider for that aspect. But also a sign that you might be pushing it too early, too soon is that you have a sudden increase in bleeding. And I think that's a really good reminder for especially our active, ambitious moms that are like, I'm ready to get back and going. And we tend to see this, around that 4 to 6 week mark where the body is like, asking for movement. It wants some promotion of the healing, right? It wants to be able to receive some load. But if we do it too far, too quick, too soon, what we'll notice is, okay, bleeding is starting to go down postpartum, and all of a sudden I'm like going through multiple pads again, and I'm bleeding again more profusely. And so this is a sign that you might be pushing it too soon, especially in those first couple months if you see a sudden increase in bleeding. So just rest a little bit more, take it a little bit slower. Other signs of more pelvic floor dysfunction would be any leakage, right? So if you're experiencing fecal or bladder leakage that is outside of your control, right? So if you don't want this to happen and it's happening without you, trying to, when you go to the toilet, it's happening beyond that, 4 to 6 week mark, I would say this is a sign that you really should be getting in with a specialist and working on this more specifically. And then again, also any bulging, tampon stuck feeling, pelvic heaviness that can feel like something's going to fall out down there. These are signs of possible prolapse. And it's important to stay on top of that as well. Of course, there's a lot of hormonal shifts that are going on in the body, and that can also impact pelvic heaviness and the sensation of prolapse. But either way, it's important to, reintegrate the body with good tone and strength. Other things is like unrelenting pain, right? So some people have really bad tailbone pain or hip pain or or pubic symphysis pain. back pain that's just like not getting better, or it's really bad at nighttime and it's affecting their sleep, this is definitely a sign that you want to get some more support, more specialized support on board as well.
That's interesting. Especially the tailbone pain.
Hmm.
Would that just
Yeah.
be, pressure from how your pelvic floor is lying, or what's the tailbone pain
Yeah.
from?
Definitely. So the pelvic floor and the back part of the pelvic floor is connected right into the coccyx, so the back part of
Okay.
the tailbone. So the pelvic floor is directly connected to the tailbone. So in birth itself, the tailbone actually fluctuates and moves so that baby can safely exit through the birth canal. And so there's actually a lot of mobility at the tailbone. But what can also happen is if they're in very long, prolonged positions on their back, or if they have a tailbone injury at birth, or especially like third or fourth degree tearing, that can cause more pain in the back part of the pelvic floor as well, cause the pelvic floor to really tighten and tense if there's an injury, which can pull and yank on that tailbone. So yeah, the tailbone is very connected into the pelvic floor and pelvic floor dysfunction.
That's interesting. I would have never guessed that. I mean, obviously, it's very close relation
Yeah.
to the pelvic floor, but I would have never guessed that that could be a sign or a symptom of
Mhm.
having any of that pain. That's super
Mhm.
interesting. Another piece I want to kind of discuss, because I think it's kind of a buzzword as well, but obviously it's a very real condition, is diastasis recti. I think
Mhm.
people kind of start to talk about that without knowing fully what that means. Can we dive
Mhm.
into that? Tell us what it is, and maybe even like what it isn't, because I do think, again, people might get it confused.
Yeah, I think there's a lot of fear around diastasis, and I think
Hmm.
that's
Hmm.
probably predominantly influenced by fitness influencers that don't exactly
Hmm.
know the research and what they're talking about in that aspect. So just to kind of clear things up, diastasis recti is the thinning, widening, and separating at the midline, right? So at your core wall, you have this white connective tissue, and that is where we'll see thin widening in decreasing in elasticity. This is normal in pregnancy. So, actually, what the research shows is that nearly 100% of women will have some form of diastasis at the end of their pregnancy. So, it's really not like prevent diastasis or this program, if you do it, it will prevent diastasis. Is like there is a natural evolution to you growing a human and your abdomen needing to stretch, and there needing to be some way that that abdomen stretches. And so diastasis is a way where that body is allowing it to naturally progressively stretch. Now, that doesn't mean we shouldn't do anything about it. That definitely means that we should be on the lookout for more signs and symptoms of issues with it. But typically, that'll happen throughout pregnancy, and then around 6 weeks postpartum, about 50% of people will still have unresolved significant diastasis that does need more attention. What we find and what we encourage is throughout prenatal, continue strength training, continue to focus on specific core strengthening as well. So there's like, don't strengthen your core in pregnancy. It's like, no, we do want to strengthen your core. We want to keep your core
Yeah.
strength as much as possible in pregnancy because we're trying to increase as much tone and tensile strength at the linea alba as much as possible so that we can reduce the amount of thinning and widening and separating that happens, but also so that you stay muscular connected to it, right? So that we
Right.
stay have that neuromuscular connection to that region of our body so that healing can happen much quicker for us as well. So in pregnancy, we do focus on, prenatal strengthening exercises that encourage the abdomen to contract and we encourage the abdomen to work together, and then into postpartum as well, early acute rehab. And then we're naturally just focused on it. But typically, if more severe diastasis would be anything bigger than like 2 fingers width. If you are
Right.
kind of, trying to feel anything larger than 2 fingers width or one knuckle deep, we'll tend to say, okay, you really should focus on some more specific core strengthening exercises that are progressive in nature, not just jumping
Right.
straight to planks.
Uh, to continue on that, I do think, and I'm so grateful to see it, that there is a lot more women's research coming out, a lot more research around, how hard can we go during pregnancy? Can you talk about what safe exercises women can be doing that maybe got a bad rep before, and maybe some safe core exercises and some things not to do while pregnant?
Yeah, for sure. I'm never like a fan of black or white. So I will always
Right.
be the person of like everything is nuanced, everything is gray, because
Yes.
everyone's abilities are so different. And comparing this mom who's never worked out before ever to a very high level CrossFit athlete, like there is no comparison there, right?
Right.
However, previously a lot of people would think that in pregnancy or old research or old, outdated doctors, if you will say like, oh, don't lift too much in pregnancy or don't strength train in pregnancy because you're going to hurt the baby or you're going to hurt yourself. And
Hmm.
actually, what the newest research is showing is that continued progressive overload and continued strength training in pregnancy helps reduce back pain, it helps create smoother labor and delivery times, mom's happier. Like, there's so many positives to moms continuing to strength train. And then there's also this belief system of like, well, what if I've never strength trained before? Should I start in pregnancy? And people with the old belief would be like, well, if you haven't done it before, pregnancy's not the time. And it's like, again, it's nuance, right? Like, yeah, if you haven't ever exercised, please don't do CrossFit in pregnancy, right? But can we
Right.
safely progress you into strength training for the very first time in pregnancy so that your body continues to keep up with the load that is, being added? Yes, absolutely. We can start strength training for the very first time, and it's really beneficial and helpful for baby and mom throughout pregnancy. In terms of safe and not safe exercises, I think that, yeah, that's nuance. I don't want to say there's any like unsafe exercises, but there can be unsafe exercises for particular people if
Right.
they're not at the place where they should be doing that type of exercise, or it's too much speed or endurance that they haven't quite trained up to being to that place yet. So we can overdo it if we're not ready for certain types of exercises in pregnancy. But there are really great core exercises as well, where we really are thinking about activating the deep core system, which sometimes people will call like hug the baby, where it's an exhale with engagement. So you're actively engaging the pelvic floor, you're actively engaging the deep core system and helping that those be coordinated and connected together. And that helps strengthen the abdomen. Just that simple exercise alone can be progressed into like 25 different things if that is your baseline and foundation.
Right. And it's, it has, I see it all the time too. I'm a group fitness instructor as well. So
Mm,
I'm in and out of the gym a good bit. And I actually just had this conversation with a member at the studio I teach at who's 12 weeks pregnant. And more than anything, and they're exercising, and I love that, but there's this fear around
mhm.
exercising and what she's capable of, whether it be from past medical advice or just not knowing what
Yeah.
to do. And I hate that obviously because I'm like, I want you to try to train optimally, but my advice is always, I don't want you to stress yourself out. So if there's
Hmm.
modifications that you need to take inside of what you're doing, please take them because I don't want you to leave here thinking that you've done something wrong, you know?
Yeah.
So
Hmm.
take those smaller modifications, take things from a seated position, do things like maybe you work on stability instead of trying to go really, really fast. So go into those unilateral movements instead. But there is so much just like word vomit or misinformation or maybe an overload of
Yes.
information around what you can actually do when you're pregnant. And I really appreciate you kind of diving into that a little bit. I 100% agree there's nuance. Some days I don't want to even go to my own CrossFit class and I am not pregnant. So I get it. Don't start it if you're just now pregnant, you've never done it before, but there is nuance inside of what you can and can't do. I think a big point as well, or a big maybe guideline or recommendation is talking about core flexion when you're
Mm.
pregnant. Can you talk
Yeah.
about that a little bit?
Yeah, again, I think it's going to be nuanced in that
Yeah.
aspect, but typically we're not having people do like, backline core crunches in
Right.
pregnancy.
Right.
So, spinal flexion in that capacity, then we're not increasing that. But there isn't like any, can you also be in a hands and knees position and bringing your knee up towards your hand? And when you're in this quadruped position, technically that is spinal flexion, but we're doing it in a different way. So I think it really depends on how spinal flexion is being done versus we can't do it or we can do it. It's like, how can we modify spinal flexion that it doesn't increase your pain or, your distress in any way? But how do we maybe think about how can we put the body in a different position and still achieve the same function?
Right. I love that. And I love a bird dog. That's one of the
I
best
know.
exercises. It's so good. And I'm like, it's so simple. And you don't think when you're looking at somebody doing a bird dog that it's going to burn that much. And then you put yourself in one, you're like, oh, no, I totally, totally feel that.
Mhm.
Any, hip thrusts are a big one. I know, again, nuance. If you've never done a hip thrust before, probably not
Mhm.
the time to start loading up a barbell with 500 pounds. But any issues that you see with hip thrusts?
No, we love a good hip thrust. Get some
Love it.
glute squats, hamstrings. Like
Yeah.
we want to build up glutes and hamstrings and that posterior back of the chain, as we call it. Because obviously, as you're growing a baby, it's naturally pulling you forward, and that's changing the postural alignment. And so, what typically happens if we don't have good strength or body awareness to our posture and where we're just hanging out in different positions, we'll notice that the pelvis will tuck, and then that will shorten glutes. It will, make the pelvic floor even tighter and tense, and will actually decrease a lot of strength in our glutes. But glute strength is really supportive to decreasing back pain and to being able to do a lot of great things in the world. But we want to keep up glute strength as much as possible because it is one of the groups of muscles that we see the most amount of muscle wasting in pregnancy and postpartum. So anything we can do to keep the posterior chain strong throughout pregnancy, we are fans for.
Yes. And I would even agree that there's muscle waste not in pregnancy, right? A lot of
Yeah, yeah.
people don't know how to train their glutes or they just don't think about it. They don't do it. And that's, you see back pain in individuals that are not pregnant, right? So
Mhm.
I love the point on that as well. All in pelvic floor health, very, very essential inside of pregnancy, outside of pregnancy for men and women. Do you ever see male clients or you just strictly work with women?
We don't personally, but there are pelvic floor therapists that specialize just in men's health. And there's a whole
Hmm.
slew of men's pelvic floor dysfunction as well that I'm not an
Hmm.
expert in, but
That's
there are
okay.
others that are.
And then
Yeah.
you mentioned children's pelvic
Yeah.
floor health as
Mhm.
well. Do you ever work with any children, or again, is it just strictly
We
women?
don't personally work with children,
Yeah.
no, but typically with like children, it'll mostly be about toilet learning, bedwetting, constipation. These are really common things that pediatric pelvic floor therapists will work with
Right.
children. So if you are a parent listening to this and you notice any of that, there is pediatric pelvic floor therapy as well that kids can be supported by.
Very cool. Well, I love that this, caught the whole trend wave, or it's now becoming a more talked about thing that we need to include in just our general health, and especially as we start thinking about conception, as we think about our journey in postpartum. Is there anything that you would tell women of any age why they should be working on their pelvic floor health, what they should be doing? Just, I know we've talked a lot about, what it looks like, but a one big piece of advice to somebody listening.
Yeah, I would honestly just get started with being able to connect to your pelvic floor. That is the first step that we would always take with any client, no matter what, is if we're not spatially, somatically, energetically connected to this part of our body, then any adaptations that we give it will not set, right? So we can't
Mhm.
build from an unsteady foundation. And so just like do that exercise of, close your eyes and find your right thumb. You should be able to do that same thing with different parts of your pelvic floor as well. Use your hands for tactile cues to get yourself acquainted to your pelvic floor. There is no shame in getting to know your body a little bit more. But I think mostly like what I really want to encourage women and moms to do is like trust themselves. If they feel like something is off or they have maybe gone to a provider and was dismissed, like keep trying. There are really great providers out there that can support you. We are happy to support you 100% virtually if you can't find anyone or you've tried a bunch of different pelvic floor therapists when you just got standardized care. But most importantly, like there is so much hope and healing if you are struggling and you don't have to live with it.
I 100% love that. And that
Yeah.
is definitely another bonus of what we're seeing with social media, is that people are now they know symptoms and they know when something's not necessarily right, and they've been given a voice to be able to say, oh, I saw Jessica on Instagram and she listed out all of these different symptoms. And I think that these are the symptoms that I'm having. And this is something that I need to take a deeper dive in. I know you work virtually and as do I. And I think, that's another great thing is you don't necessarily even have to leave your home, or you can reach out to us on Instagram or via email and we can help you. It's not just
Mhm.
having to go to just your one doctor and ask them every single question. And I think what we're learning too is our doctors don't know everything about everything, right?
Hmm.
Like if
Hmm.
they are trained in one area, they're not necessarily going to know something about this over here, right?
So true.
hmm
Hmm.
Can you tell our listeners how to find you, your Instagram account, maybe your website, if they would to wanted to book with you or ask you more questions?
Yeah, definitely. So you can find me on Instagram at your postpartum PT. It's YOUR and then postpartum PT. I'd also love to give your listeners like a 7-day free trial to our pelvic floor and core collective.
Awesome.
So if they DM me trial, then they can go ahead and get a 7-day free trial to our community and our collective. It really is set up for pregnant and postpartum women that are looking for evidence-based research education so that they don't have to spend all their time on Google or ChatGPT these days.
Yes.
But they'll also have the right protocols and rehab plans 0 to like 6 months.
Amazing. And we'll make sure to include that in the show notes as well so that they can find
Mhm.
you via your Instagram and get into that 7-day free trial. Incredible. I am so grateful for you taking the time to be on our podcast. I wish Josh was here. He would have loved all of this, especially as we get into like a little bit of that woo-woo stuff. He gets into it
Mm,
too. So, so
amazing.
great. I really appreciate your time. And I hope you have a great rest of your day.
Thanks for having me.
Thanks.